Hi, I am so elated to meet you in the program of 1 minute please. So, yesterday we received one case of constipation was found to have hypercalcemia. So, what do you mean by constipation? So, constipation is defined as passing stools less than 3 times a week. So, what are the major causes of constipation? Of course, there is something called functional constipation. But before you label somebody to have functional constipation, you have to exclude all kind of organic or some treatable causes. So, what are the causes of constipation? So, some important medical causes could be with respect to electrolyte, when you find hypokalemia and hypercalcemia, like in our case, can produce constipation. And some endocrine disorder like hypothyroidism and diabetes mellitus can produce constipation. We have witnessed, but it is reported that diabetes insipidus could produce constipation. Then what are the drugs? There are few drugs which commonly we use can produce constipation. Very commonly antidepressant, among antihypertensive calcium channel blockers and anti-Parkinson drugs, especially anticholinergic drugs, and narcotics, especially morphine, can produce constipation. These are the few drugs that can produce constipation. And some causes of anatomical obstruction, especially you should not forget that any bowel obstruction in the form of bowel malignancy or stricture, or sometimes in the lower GI pathology like thrombosed hemorrhoids and anal stricture and so on. So, what are the alarming causes of constipation, or I could say what are the alarming signs of constipation or alarming symptoms and signs of constipation? One, if there is unintentional weight loss more than 5 or 6 kg in 6 months, and second one, loss of appetite and profound vomiting and abdominal distension, decreased bowel sounds or increased bowel sounds, all may be signaling bowel obstruction secondary to bowel malignancy or some kind of intraluminal obstruction, or any patient who presents with anemia and weight loss, abdominal mass and abdomen tenderness and increased bowel sounds, anemia and bleeding PR. Then any patient around the age of 50 years with recent history of constipation, better to explore the causes. So, these are the few alarming signs and symptoms of constipation. So, what is the mode of investigation? Apart from routine investigation, better to look for anemia, may be a part of large bowel obstruction in the form of malignancy, and you can do erect abdomen and CT abdomen and so on. So, these are the few points that I would like to discuss with you on constipation. Thank you.